welcome to this video. My name is Adriana and I'm a community pharmacist and I specialize in over-the-counter medications. And in today's video, I'm going to talk about the difference between bacterial vaginosis and a yeast infection. The three most common vaginal infections include bacterial vaginosis, trichomoniasis, and vulvovaginal candidiasis, also known as a yeast infection. So before we get into the different types of vaginal infections, let's talk a little bit about the vagina, the flower, the yoni, the vajayjay. So once you hit puberty, there's an increase in estrogen. The increase in estrogen changes the vaginal lining to a stratified epithelial squamous cell. Now, these cells contain something called glycogen. The vagina contains a bacteria called lactobacillus, and these bacteria are responsible for converting the glycogen into lactic acid. The lactic acid creates the acidic pH for the vagina. So a normal vagina should be between 4 to 4.5 pH. So the acidic pH of the 4 to 4.5 and the production of hydrogen peroxide by these bacteria is what protects the vagina from bacterial infection. Also, during and after menopause, estrogen levels decrease, so this also decreases the lactobacilli, which increases the pH and makes women of menopausal age more prone to vaginal infection. So the healthy vagina is normally cleansed daily by secretions that lubricate the vaginal tract. Normally, the vagina produces about 1.5 grams of secretions per day. It's normal to have an increase in vaginal secretions during ovulation, during pregnancy, right after your period, and also with sexual stimulation. On the other hand, you can have an increase in vaginal secretions in response to some type of irritant. And this could be certain feminine hygiene products, certain vaginal deodorants, douches, some contraceptive products, and tampons. All right, ladies, so let's just get right into it. So, how to know if you have a yeast infection or bacterial vaginosis. So it's all gonna boil down to color of the discharge, smell of the discharge, and certain symptoms that you're having. So, bacterial vaginosis usually has a fishy, foul odor, and a yeast infection usually has no smell. However, trichomoniasis, which is an STD, that also has no smell. So it may not be bacterial vaginosis, but it might be trichomoniasis. Also, the discharge for bacterial vaginosis tends to be off-white or discolored. Some women will have gray, tan, or even green discharge. And for a yeast infection, discharge is usually very thick, it's white, and some women describe it as looking like cottage cheese. Trichomoniasis will present with a yellow or a green discharge. And also you'll have vaginal irritation or redness. Yeast infection will also have vaginal irritation or redness. Bacterial vaginosis typically does not have any vaginal irritation. All you really have is that odor and a lot of wetness. With a yeast infection or trichomoniasis, you don't really have a lot of wetness, but you do have a thick discharge. Bacterial vaginosis is thought to be caused by an imbalance in the normal vaginal flora. There's usually a decrease in the lactobacilli bacteria. Another sign of bacterial vaginosis is an increased pH above 4 to 4.5. Usually a yeast infection, you will have a pH of 4, 4.5 or lower. One of the main risk factors for bacterial vaginosis are having a new sex partner, because this can kind of disturb the vaginal flora. And also African American women tend to be at a higher risk. For yeast infections, there's really an unknown cause, but you're at more of a risk if you're on antibiotics or certain types of medicine that suppress your immune system. Patients with HIV, patients with diabetes usually have a higher risk for developing a yeast infection. All right, so we talked about differences between bacterial vaginosis, yeast infection, and trichomoniasis. So important things to remember. You most likely have bacterial vaginosis if you notice a foul-smelling, fishy odor and you have a lot of wetness. You usually won't have any type of vaginal irritation or redness. And usually the odor gets worse after sexual intercourse. You're more likely to have a yeast infection if you have cottage cheese-like discharge, no odor, but a lot of vaginal irritation. You're also more likely to have trichomoniasis if the discharge is green to yellow and you have vaginal irritation. If you suspect that you have trichomoniasis, you need to see a doctor right away because this is a sexually transmitted disease. If you suspect that you have bacterial vaginosis, this usually is treated with prescription metronidazole. However, there are some natural remedies available. If you suspect that you have a yeast infection, there are both over-the-counter and prescription options available. I'd strongly suggest purchasing the vaginal pH tester. Knowing the pH of your vagina will really help you lead to the correct diagnosis and will also prevent delaying of your treatment. I also have attached below a chart comparing the differences between bacterial vaginosis, yeast infection, and trichomoniasis. So please check that out.